a 27-year-old female who resides in the U.S., a Hong Kong resident, and then on the 11th of April, starting from the 11th of April, she suffered from loss of smell, taste, and had sore throat and blocked nose for a week, and then she recovered after a week. And on the 4th of May, she returned to Hong Kong to visit relatives. She was asymptomatic, and she did not consult a doctor when in the U.S. She came back on CX811. At AWE, she left a deep throat saliva sample, and the result was positive. She has no other close contact, and she was on her own, and she has not returned to her place. And then this is a relatively simple imported case. Dr. Lau, please report to us the situation with the HA. Good afternoon. As at noon today, in the past 24 hours, HA has reported 15 suspected cases to the Department of Health. Together with patients still in hospital, we have 151 patients receiving isolation treatment in our hospitals. In the past 24 hours, we've got 21 confirmed cases recovered and discharged. So far, we have got 899 confirmed and 1 probable case recovered and discharged. As at noon, 136 confirmed cases are receiving treatment in 14 hospitals, 1 in critical condition. Case number 595. 6 other patients are in serious condition. 338, 417, 461, 698, 713, and 857. The other 129 patients are in stable condition. As at 9 a.m. today, we have opened 1,231 negative pressure beds, occupancy rate 37%, and 669 negative pressure wards, and the occupancy rate is 50%. That's all from me. Thank you. Q&A, please raise your hand, and we will pass you the microphone. And before you ask questions, please identify the organization you represent. The lady at the back. Good afternoon. I'm from Now TV. The confirmed case today is imported. So we have gone through 14 days of no local confirmed cases. I'd like to ask whether this is the opportune time to relax the prohibition on public gatherings, and whether closed premises can be reopened, and which are the safer premises to reopen first. And there is news that you may relax the prohibition on the seating restrictions in restaurants. Now, if you really do so, well, 8 may be allowed in a restaurant, but only 4 are allowed in a group on the street. Is that really meaningful? And then they said that with no local cases, perhaps people can do away with their face mask. Do you think it's time for us to relax? It's true that we've seen, or we have gone through more than 1 incubation period with no local cases. Some local experts have talked about relaxation of restrictions and prohibition on public gatherings. I understand that the government is studying the issue to see, given the current situation, what are the more balanced measures to take. On the one hand, we want to control the outbreak, and on the other hand, we can relax some of the restrictions imposed on the public. For surgical masks, I believe we still need them because we have asymptomatic patients or patients with minor infection. So it is not appropriate to relax the rule on surgical mask yet. This gentleman in red T-shirt, I'm from Commercial Radio. So for 15 days in a row, we haven't had any local cases. Have you assessed the probable percentage of asymptomatic patients in Hong Kong, and the Medical School of CU Hong Kong has embarked on a project to a study on the number of asymptomatic patients in Hong Kong. They're going to test 3,000 persons. Is that good enough? Would you cooperate with CU in order to find out more asymptomatic patients in Hong Kong? Yes, among 1,000, we have at least 100 of them that were asymptomatic, but that may not represent the true ratio, because initially we did not test so many members of the public at our ports. We tested many returnees, and as a result, there were cluster of asymptomatic patients, and then at quarantine centers, a test is implemented on the 12th day. So we have identified more asymptomatic patients, but that may not be a realistic picture of the actual ratio. We welcome that study by CU Hong Kong, and we hope that we'll be able to learn more about the COVID-19.
Free press. So provided that European countries have cast doubt on China's zero cases statistics and said they would not include China's pandemic data out of the public health and safety concerns, is the government acting responsibly in trusting and taking into account dubious data when implementing disease control measures, including relaxation of border control in the future? And the second question is, have border restrictions or social distancing measures had the greatest impact on reducing the number of daily infections? And if the former, whether easing travel restrictions should be the last thing the Hong Kong government should do when resuming normal operations? Thank you.
Can you repeat the first question again?
Several European countries have cast doubts on China's zero cases statistics and said they would not include China's pandemic data when assessing the pandemic situation. So is Hong Kong government acting responsibly in trusting and taking into account these data when implementing disease control measures, including relaxation of border control in the future?
We have quite a close collaboration with the mainland China health authorities, including Guangdong health authorities. So we have a daily exchange of information and data from the mainland and Guangdong. So we trust their data. And it's very difficult to tease out which measures in the we have a basket of measures, including border control measures, social distancing measures, contact tracing, isolation of cases, etc. So at the present moment, it's very difficult to tease out the parts played by each measure. So, but I think in considering which part and which measures and which part played the most important part to control the epidemic. Various experts have given their opinion. I think the government will consider as a whole and which part to relax first.
As you've mentioned, it's been more than 2 weeks now without a local case. Are you confident that the local transmission chain has now been broken? And do you think it is safe actually to relax some of those physical distancing measures? And looking ahead, in terms of, do you think that there will be a sort of a resurgence of this virus in the winter? And how can we sort of check the prevalence within the local community? Are you going to be doing your own tests or sort of relying on other people?
I think this disease has quite a long incubation period and can be up to 14 days. And usually we take 2 incubation period as the duration for stop of the local transmission. Although we have observed already 1 incubation period, and seems the situation is getting better now, but we cannot conclude that the local transmission chain has been stopped. So it may not be, but whether relaxing the physical distancing and other measures may not necessarily tie with exactly the 28 days. So we can have other factors to consider. So, and this is a new disease. It is very difficult to predict what is going to happen in the near future or in the winter time. Although some experts had said that, there will be another upsurge near the winter time, but it is very difficult to predict now. Yeah.
下一位嗰邊第三行深色衫嗰
Third row, the lady in a dark dress. I'm from Hong Kong 01. Regarding the latest case, the person who returned from the U.S., do you have results of the tests on the passengers who flew back to Hong Kong on the same plane with her? And were there many passengers on that plane? You said that there were no close contact in respect of this person, but what about people sitting in front and behind her on the plane? Would they be regarded as close contacts? Another question is about the tests conducted at the port. At the airport now, you have very, very tight, testing procedure. They have to either wait for the test result or moved on to have to be quarantined in a hotel. But now you're asking them to, submit samples. What is the percentage of the vials which have now been returned? So would it be, would you do like what you do at the airport and require them to actually, submit, the different samples before they're allowed to go? And also for those people who come into Hong Kong from Shenzhen Bay, would there be a risk of their infecting the people of Hong Kong? And also regarding the quarantine center at the Chungyang Estate, if you deduct the number of returnees, the 317 returnees from Pakistan, 2 of whom have been confirmed cases, you have more than 60 close contacts. So have these people been breaching the quarantine order? Or is it that these people have just returned from other countries and you're not able to provide them with, places of quarantine? As for 6881 and how many passengers there are, we've not taken account of that, but the test results of all the passengers are now coming out. Today, we will definitely will have all the results. For the close contacts, normally we will count the passengers sitting 2 seats in front and 2 seats behind the person concerned. For all the persons concerned, other than taking their different samples, they are now in home quarantine. So we've not actually moved those close contacts to the quarantine center. Whether there's a a bigger chance that they get infected on the plane coming to Hong Kong, or whether they were infected at the place where they come from, is difficult to tell. So far, we're not able to arrange for them to stay behind and wait for the result of the tests, except for people who come from, say, Peru, and then we would send them to the quarantine center. This is only, a risk control measure. So I think the risk, is higher in other countries rather than the mainland. If you look at now, it's very likely that during the day at the quarantine center, other than people who return on the charter plane, there were also those returning from QR 818. And they've all been sent to the quarantine center. Or, returnees from Pakistan, whether they come from Qatar or who returned in a charter plane from Pakistan, they've all been sent to the quarantine center. Well, I don't have the information offhand. I think it should be 70-80% or 90%, but I don't have the exact numbers. The lady at the back. Good afternoon, Cable TV. My name is Tam. during the May 1st holiday, many local residents have gone out, gone to the beaches or Sai Kung. Many of them even don't wear surgical masks. Would you think that this is dangerous? Would you think that certain places are rather dangerous and people shouldn't let down their guard at this point? And if you want to go out, what are the things that they should pay attention to, and do you have any suggestions for them? And regarding the chain of local infection, has that been broken already? Because over the last 15 days, we haven't had any new local case. Has the government reviewed the whole situation? Will the situation improve in the course of summer? And towards the end of the year, what do you think will be the state of the epidemic? At the moment, the epidemic is now under control in Hong Kong. Is it the case that the local infection chain has now been broken? Regarding the local infection chain, whether or not it's been broken, now we would basically look at 2 incubation period. If you take the longest incubation period, which is 14 days, then we will, look at a period of 28 days. Now, there could be patients who are asymptomatic or people who only have very mild symptoms. If you have an asymptomatic, patient, transmitting the disease to somebody else who doesn't have any symptoms. So it may be a very long time before we discover a second patient. Of course, we cannot extend indefinitely and say that we will only start counting after 10 persons have been infected. Now, normally, if we don't see any new cases after 2 incubation period, we will consider it to be safe, and it's possible that the infection chain has been broken. But it's not 100% for sure. This is only, our method of calculation. Well, 1 incubation period has now lapsed, and I think we now have some comfort that the situation is improving. But I don't think we are 100% confident. We may not know as to when there will be another local infection case before we can confirm whether the local infection chain is broken or not. Of course, at the moment, most of the cases are imported cases. Hopefully, that will be the case going forward. For imported cases, it's not very likely that these, persons will, stay in the community and cause any local infection. Over the past few days, people have been letting down their guard, have been going out to beaches and so on. So I think we need to pay attention, for example, when we take public transport, because they are usually very crowded. People may actually tap the cards or hold on to the handrails, and I think they should, pay attention and be sure to clean the hands and so on. And during mealtime, people don't wear masks, and at places which are crowded. And when people, remove the mask and chat and so on, then that would be a rather, risky, thing. Going forward, if the epidemic, overseas subside gradually, but whatever the case, we expect that may still be some imported cases, but there shouldn't be. We believe there will be fewer, local cases.
I'm from Ming Pao. Dr. Zhang, today the government talked about exempting Hong Kong manufacturers with production plants in the mainland, and then they may be exempted from quarantine, and when they return to Hong Kong, they will be subject to medical surveillance without any test. Is that sufficient or appropriate, in your opinion? And it is circulated online that returnee from overseas stayed in Regal Oriental waiting for tests of the COVID-19, and then they complained about the sanitary conditions and of the toilets in the hotel rooms. We will follow up on that. And the third question is, talk about recovered and discharged patients tested positive again. You talked about meetings to be convened within the HA. What is the follow-up? Giving exemption to certain Hong Kong people free from mandatory quarantine upon return to Hong Kong. There has always been such an arrangement. It's just that another category of people has been added, and the CS4A has the authority to do that. We're already exempting some groups of people coming to Hong Kong. They're only subject to medical surveillance. So with the increase in the scope of exemption, of course, the risk may be high, but not as high as you may imagine. And as for condition of hotel rooms, I have heard of such information, and we followed up with the hotel. And it was heard that the arrangement was put in place or to switch room or to put in another room, but then the returnee was released very soon. And as for discharged patients and tested positive again, we will have an announcement when we have made a decision.
The Morning Post. With the relaxation of the social distancing measures, would the CHP recommend that mask wearing be made compulsory? And my second question is, the former Health Minister Yeo Eng Kyung suggested that Hong Kong should cooperate with other countries or jurisdictions to test travelers before they leave their countries of origin. Is this something that the CHP would consider doing or the government will consider doing? Thank you.
So I understand that the coverage, the percentage of wearing masks in Hong Kong is quite high. It's 97, 98%. So it may not be necessary to ask for compulsory by legal measures. I understand the people in Hong Kong are very concerned about their own health, so they would try to do measures to protect themselves and as well as others. So, and also we are adopting a testing strategy on arrival. We have not yet deliberated on other measures such as testing the travelers overseas before they come back. Yeah.
嗰位女士，三。
I'm from Apple Daily. Regarding the situation of the toilet, the feces from the toilet bowl, according to some reports, the hotel staff reflected that it was a long-standing problem of the hotel and the situation was not unique to the hotel room. Have you tried to understand the situation? Because of fecal matter in the hotel room, what is the risk to the returnees? Have you assessed the risk? Well, regarding the details, I'm not very well aware of them, but as soon as we learn of the situation, we discuss with the hotel to get him to another room. However, by then, the result was almost available, so the decision was for the returnee to wait for the result and then leave. Whether the result is available now, I have no idea, but we'll follow up with the hotel. The gentleman at the back. I'm from Stand News. 3 questions. There's news that the government may relax the prohibition on group gatherings from 4 to 8. Now, from a medical point of view, whether it should be 4 or 8, what is the basis? Why not relax it to 10 or 12? And for LCSD, venues reopened, large sports grounds such as basketball and football, pitches they are not yet open. These activities are very popular. So is it really risky for people to engage in ball games? Can you relax this restriction? And a question for the HA, can you give us an update of the conditions of patients, the number of patients that are serious, in critical condition and stable, the number of patients discharged? And is there plan to resume the non-essential services of HA as well? Whether the ban on group gatherings should be 4, 8, 10. I think the spirit is to advise against group gatherings to prevent transmission of the disease. As for Y4, in other countries, some cap it at 2, some at 8 or 10. So we took the average 4. Even if we relax it to 8, I think it's for the sake of Mother's Day gatherings. Some have larger families and they may want to gather on that day. There is no scientific basis as to what is the best number. Understand that for some activities, there are more body contacts, such as in ball games, and I believe the government will take a step-by-step approach. Now, let me repeat. We have 136 confirmed cases receiving treatment in 14 hospitals. One is in critical condition, number 595, and 6 patients are in serious condition. And 129 patients are in stable condition. The 6 patients in serious condition is 338, 417, 461, 698, 713, and 857. The situation has stabilized. Starting from this month, we will gradually resume non-urgent services. On the ground that we have a backlog of patients, and some of them have been waiting for a long time for outpatient visits as well as non-urgent operations. However, we have to take care of a few things. First, our control measures, infection control measures. After all, the disease is not yet fully eradicated in Hong Kong, and we don't know how long we have to wait until there will be 0 cases. So infection control is important, including patient flow, seating arrangement, and queuing arrangement. And also we have to consider the available of PPE. We have to reserve PPE to handle another upsurge, should there be one. So we have to control our stock of an N95 respirator. We're worried that now we have a stockpile of 2 months of N95. And there is also an export control of N95 overseas. So we have to take care of our stockpile of PPE, and we also have to consider manpower because some staff have been deployed to take care of COVID-19 patients, and we have to redeploy manpower to take care of other patients. So it all depends on the need and also factors I just mentioned. Diagnostic services, including radio diagnostic and computer scanning services, will be resumed first, and daytime specialist services and non-urgent operations will follow. And then we'll gradually increase the number of inpatient services. Now, we cannot resume all services in one go. We have to adopt a gradual approach, and we have to reserve capacity to cope with the possibility of another upsurge of the disease, so that we won't be lack of resources and manpower to tackle the situation. I hope the patients can understand our situation.
We can take one more question. I'm from the Economic Journal. For the Regal Oriental Hotel, how many people on average are staying there? Had there been, more patients, more people living there, that the hotel had to send them to the quarantine center? And when checking whether the hotel is an appropriate venue, have you checked the toilet bowls and drains to see whether or not it was appropriate? Why is it that we have this situation, and how are you going to follow up on that going forward? I understand that every day there are about 200 to 300 people staying at that hotel. It would not be the case that if there are more people, then the patients can wait at AWU for the result of testing rather than crowding all the people there at the hotel. Or some people would need to go back, to home quarantine. When we chose that hotel, we did, inspect the facilities to see whether or not it's appropriate. As to the situation you described is true or not, we need to follow up on that further. So if there are no further questions, I think that's the end of our press briefing today. Thank you.